Breast size has nothing to do with how much milk you can produce. They might have entree, main, dessert, and supper even. If you've had a preterm baby, your milk is likely richer in certain nutrients. Hey everyone, welcome to Lactation with Amy. In today's video, we're going to talk about some of the biggest myths about breastfeeding. Whether you're a new mom, an experienced one, or someone that's exploring your breastfeeding options, there's a lot of misinformation out there that can make you second guess yourself. So let's debunk these myths together today and get you the facts that you need to make informed choices for you and your baby. Let's get started. You always have to feed both sides at each feed. And the answer is not necessarily. Every mom and baby are different. While some women may need to feed on both sides at each feed, others may find that their baby is satisfied from nursing just from one side. Just like us, babies can have smaller and bigger appetites at different times of the day. Sometimes they will just have a snack feed, which is a small feed. Other times they might be super hungry, trying to get all the energy they need to have a big meal, so they might have entree, main, dessert, and supper even. So while some feeds can be quite short and baby will only feed off of one side, other feeds may take longer and your baby might need to feed several times to appear settled. Your body is always going to adjust to your baby's need, so don't be pressured to follow a rigid feeding routine. Myth number 2. Breastfeeding is always pain-free. Not quite. Breastfeeding can be uncomfortable at first, especially for new mothers or babies who are learning to feed. If you're experiencing pain, it's often something that can be corrected by adjusting the positioning of our baby when we're breastfeeding or chest feeding. Looking for an open gape and positioning baby well will help reduce nipple pain. However, if the pain persists, it's always a good idea to consult with a lactation consultant to rule out any other issues such as severe nipple damage, nerve responses, and infection. I have a video that troubleshoots nipple pain step by step with you to find the cause and find the root of the problem, and it gives you extra tips to reduce pain. So if you're currently experiencing nipple pain, please click into that video and hopefully it helps you. Remember, breastfeeding isn't always pain-free, but pain shouldn't be a normal part of breastfeeding. Myth. I have size A breasts so that I don't make enough milk for my baby. Breast size has nothing to do with how much milk you can produce. Just because you're an A cup or a B cup doesn't mean you can't provide enough milk for your baby. Milk production is determined by glandular tissue in your breast and not their size. What really matters is early and frequent breastfeeding. For some women with smaller breast storage, your baby may need to feed a little more often. For example, a baby can feed on one side and become full from that, or a baby can breastfeed on both sides and then call it a feed and appear settled after that. For women with smaller breast storages, your baby might need to feed left, right, left 3 times at each feed, or left, right 4 times at each feed. This is also called switch feeding. Your body will adjust to your baby's needs. If you're concerned about supply, it's always a good idea to reach out to an IBCLC for support. They can help you figure out a feeding plan that works for you and your baby. Insufficient glandular tissue is when our breasts are not equipped with enough glandular tissue in puberty or pregnancy. If you have insufficient glandular tissue, it may contribute to a low supply. However, please speak to a lactation consultant to discuss how we can maximize supply with the existing glandular tissues that are available. And don't give up, there's lots of options out there. Myth number 4. My milk is not as nutritious as my friend's milk. Your milk is perfectly tailored to your baby's needs, and there's lots of research to suggest that. If you've had a preterm baby, your milk is likely richer in certain nutrients to support their growth. Your diet, however, can change the composition of your milk, so having a healthy, wide variety of food, eating regular meals including morning tea and afternoon tea on top of breakfast, lunch, dinner, will give you energy to look after yourself and your baby. If you have certain vitamin deficiencies, it is always best to address these with your doctors for the optimal health outcome for yourself and let it carry through in your milk. If your baby is struggling with weight gain, even though your milk supply seems abundant, there may be other factors at play. In these cases, it's important to consult with your pediatrician as well as a lactation consultant for a comprehensive assessment. Myth number 5. Babies should breastfeed every 2 to 3 hours like clockwork. Not all babies follow the same feeding schedule. Some babies will cluster feed, especially during growth spurts. Some babies will start to sleep longer once they're 3 to 4 months old. Some babies still don't sleep for long periods of time by the time of 1 year old, and they're all completely normal. It's more important to watch for signs of hunger and feed your baby on demand. A healthy baby usually breastfeeds 6 to 12 times per day. Every baby is different, and their feeding needs change from day to day depending on their needs. In fact, I've made a whole video explaining reasons why babies might not be sleeping through the night, and are they hungry, are they not hungry, and if you're interested, be sure to check it out. Myth number 6. You can't breastfeed if you're sick or have mastitis. This is absolutely not true. You can definitely continue breastfeeding if you're sick. Mastitis usually occurs as a result of change in your breastfeeding routine, usually caused by less frequent breastfeeding causing a plugged duct, which then develops into an inflammatory response, ending up with an infection over a certain period of time. So we most definitely want you to continue feeding with mastitis, because babies who can breastfeed well will actually be the best cure for these plugged ducts. Even with conditions like the flu, COVID, or a cold, breastfeeding can actually help protect you and your baby from getting sick. When you're sick, your body produces antibodies that pass through your breast milk, providing a natural defense for your baby. Just make sure to wash your hands and take precautions to prevent passing germs. If you're taking medication, be sure to check with the pharmacist to make sure that they're safe for breastfeeding. If you have HIV, hepatitis B or C, or an active herpes outbreak, please refer to your local government resources regarding safely breastfeeding your baby with pre-existing conditions. So there you have it. We've busted some of the most common breastfeeding myths. Remember, every breastfeeding journey is unique. It's okay to speak up, seek support, and ask questions along the way. Don't let misinformation make you doubt your abilities. You can do this. If you found this video helpful, please give it a thumbs up and share it with your friends, and don't forget to subscribe for more tips and debunked myths. If you have any questions or want to share your own experience, drop a comment down below. I would love to hear from you. Thank you for watching, and I'll see you next time. Bye!